If you're having surgery and you're worried about going to the hospital where it's cold, scary, and there are lots of sick people, you're probably wondering if there's a better alternative. Hello and welcome back to the channel. If you're new here, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York, and I specialize in sports medicine and arthroscopic surgery. Many years ago, most surgeries were done in a hospital. However, with limited resources, very often there would be long wait times, sometimes weeks or months before someone would be able to have surgery. Because of this need, ambulatory surgery centers were created. What's an ambulatory surgery center? Well, essentially, it's having an operating room with the staff, the equipment, the surgeons, the anesthesiologists, everybody in a freestanding building. In the US, over 50% of outpatient surgeries are done in these ambulatory surgery centers outside of a hospital. Let's go over the 6 benefits of having surgery at an ambulatory center. Number 1, there is a lower risk of getting an infection if surgery is done at the surgery center as opposed to the hospital. The CDC shows in its statistics almost a 50% reduced risk if the surgery is done at the surgery center. Number 2, surgery at an ambulatory center is much less stressful than in a hospital. From my personal experience working with patients, some patients who've had surgery on different body parts almost always tell me that their experience at the surgery center was much less anxiety-provoking than in the hospital. To a large extent, this is because the ambulatory center is smaller, more personal, more attention to the patient. It's not as chaotic as being in a hospital, and this helps reduce the stress of the experience. Number 3, there is a lot less wasted time in an ambulatory center than in a large institution. There is research that shows that for the patient having the same procedure at an ambulatory center versus a hospital will save 25% of their time. And there may be several reasons for this. One, when someone has surgery at a hospital, they have to get there several hours in advance because there are just so many patients, whereas at a surgery center, that's not the case. Another reason is that scheduling surgery at a surgery center is much more predictable. In a hospital, there are sometimes emergencies or more complicated cases that can take up more time, and patient scheduling gets pushed around and there can be delays, whereas that doesn't typically happen in a surgery center. Number 4, you get the same awesome surgeon. So whether or not you have your surgery at the hospital or at the surgery center, it's your same surgeon, you have same excellent anesthesiologists and nursing staff. It's everything but just transplanted over to this separate location. Now, procedures done at a surgery center on average take 30 minutes less than if they were done in a hospital. And this is likely because of efficiencies, and also, again, it's your surgeon who's performing the entire procedure. This translates into less time under anesthesia, which is better and safer. Number 5, safety and greater satisfaction scores at the ambulatory surgery center. Surgery centers, just like the hospital, are highly regulated by the government, and they have to maintain credentialing and certification. So they go through all the same processes so that patients can feel that they're in a safe and protected environment. However, patient satisfaction scores are typically much higher at the surgery center. Number 6, lower costs at the surgery center. Outpatient surgery centers are typically 45 to 60% less expensive than the hospital. For example, there are some estimates that for a knee arthroscopy procedure done at a surgery center can cost about $1,200 less than if it was done at a hospital. The Department of Health and Human Services estimates savings of $15 billion to taxpayers and $3 billion to Medicare patients if all the qualifying surgeries were performed at the outpatient surgery centers. So that's a big savings. There you have it. 6 reasons to choose an ambulatory surgery center if you need to have surgery. You may want to also check out my orthopedic playlist where I review some of the most common orthopedic procedures. If you found this video helpful, please tap the like button below and subscribe to this channel. Thanks for watching. I look forward to seeing you in my next video or maybe in my office.